Good evening, CAN TV. Oh, there we go, Rochester. I'm sorry. Good evening, CAN TV viewers. Thank you for tuning in to the Doty Report on Comprehensive Health. My name is Yolanda Gibbons, and I am your host for the show, and this is our last show until October, so we are going to have a great time. I have two beautiful ladies sitting to my right, and so we're going to have some great conversation as always. The whole premise of this show is to provide you, the viewers, the community, with information as it relates to health, and people put health in a box, but there are so many aspects to living healthy lifestyle. So today we're going to be talking about dental health, and we're going to be talking about mental health and how that's even connected to the veterans. And we've been on having discussion about the veterans and the resources for them for the last couple of weeks, because we have an event coming up on August 1st, and I'll make sure to share that. Always, I want to give a shout out to Mr. Don Doty, the founder and CEO of the Georgia Doty organization, and his wife, Miss Joyce, and we want to say hello.
Hi.
To them. We want to say hello to our viewers on Facebook Live. We got some great information, so I want you guys to keep watching. So we're going to get right to it, because we only have 30 minutes, and you know, when you get three women together and we start having conversation, yeah, we can talk forever. We want to make sure we get as much information in today that we're able to share and give you guys some really good tips and information and resources. So on my first right, my right, I have Madeline Robinson, and next to her is Tenisha Phillips, and these two ladies are BFFs. They are BFFs. Yes. They are both professionals in healthcare field as well as entrepreneurs, so I'm going to give them a couple of minutes to tell us a little bit about themselves, and then we'll get into some discussion. So let's start with you, Madeline.
Thank you, Yolanda. I really appreciate that. I've been in the dental field for over 12 years. Okay. I am a licensed EFDA, CDA. I hold various positions within the dentistry field. One of my last success stories was that I'm an adjunct professor. Oh, nice. So I did teach dentistry for a nice little time. So that was very fulfilling to be able to take what I know and pass it on to the next level of dental professions. And I'm very excited about teeth. I've worked for various doctors, and some very prestigious ones at a very prestigious hospital in Chicago. So Northwestern definitely has taught me a lot about the field, working side by side with people who just internationally are known, and it broadened my skill set, and I would love to share what I know about dentistry with anyone who's here to listen, because it's definitely a topic that goes unnoticed, and we don't talk about dentistry a lot, and a lot of people are naive to the health care that comes internally that starts with your mouth. Right. And I want to just be able to express that today, and hopefully I help someone kind of understand a little bit better about what's going on inside of them as well as their mouth. Right,
so. Absolutely. We definitely gonna get into that conversation. So, and your BFF next to you, Tenisha, tell us about you.
Oh, man. Wow. So I recently started my own brand, Philip Sims LLC, Philip Sims Wellness, where we are working on mental health, health and wellness, social justice, and really how important that is within our community. And so within that social justice and mental health piece is really just about altering our mind states, changing the stigma of mental health within our communities, because that's so important. So huge when it comes to something just as simple as depression, domestic violence, sexual assault, gun violence. All of those things are really mental health tied that we, you know, don't really aren't really cognizant of, don't really pay attention to. So yes, so there's that. I too am an adjunct professor, so I teach psychology, undergrad psychology and human services. I teach multicultural competency, so I'm very much into social justice and how our culture is affected within society, both locally and globally. I also am a psychotherapist on the west side. at a hospital there. So I deal with various different types of populations: schizophrenia, bipolar, depression. So this population on any given day could be hearing voices, seeing things that aren't there. A lot of them are homeless. I deal with a lot of co-occurring disorders, which means that they're dealing with substance abuse and mental illness all at the same time. And so one thing at one point in time could affect the other, or one could be using substances to self-medicate because they either cannot afford medication or don't have access to it. And a lot of this population, they don't have access to therapeutic services, or again, are coming from our cultures where this stigma is prevalent, where, you know, it's just, oh, well, they a little touched, as we used to say. You know what I mean? Instead of really going to get them help, you know, you putting them in the attic, you know, this is beyond your control, okay? This is beyond your doing. So there's that. And then last but not least, I'm in my PhD currently right now for counselor education and supervision. So I am almost done with that. Very, very happy about that. Yes, so that is me in a nutshell, right?
Exciting to have.
Yes. And very excited, by the way. I'm sorry to intervene, but very excited to have my bestie sitting next to me during this TV show. So very excited about that. Yes.
Where's my bestie at?
Yeah.
So much
supposed to be watching besties. So let's get into it. We are here to talk about health. I want to start with the oral health piece. And so, what are some basic general oral health standards that we should all be practicing daily?
Definitely. Yolanda, we definitely need to understand that oral health is essential to your health. Definitely. The mouth is one of the gateway avenues to internal diseases. We don't understand that bad oral health promotes joint pain, joint illness, heart attacks, stroke. Yes, having a bad periodontal or having bad gums or having gum disease can definitely put you in the avenue of having respiratory problems, having cardiovascular issues, having sinus issues, even having joint pain. Your knee could be a part of your oral problems, if that makes sense. We should definitely be brushing twice a day. Definitely brush twice a day if you can remember to do that. Flossing is the #1 prevention of cavities. Not brushing, not getting your Colgate, but actually getting that little string and getting in between those teeth, because that's where cavities start. They start in between the teeth. So we definitely should be flossing, and we definitely should be using a mouthwash, some type of mouthwash, an Axe, a Listerine, something that's alcohol-free, that doesn't dry out the mouth. And that also definitely helps keep the gums strong, which holds the teeth. So if your gums are bad, your teeth are definitely heading down that path. So we need to be changing our toothbrushes at least 3 to 4 times a year. You should always get a brand new toothbrush, and definitely if you're sick, if you have any type of illness, change your toothbrush after you brush your teeth. So that's just general, basic 1-year-old to 99, you know, things that we should be doing, especially for your lifestyle. You know, you drink a lot of coffee, you drink a lot of diet products, wine, spaghetti, you smoke, you're a smoker. You know, these things definitely change your enamel, change how your breath is, change a lot of, you know, dynamics, and we got to just start paying attention to that. Plus, you know, when you're talking to people, the first thing they see is your mouth. So that's your beauty mark. You know, I'm going to look at your mouth, you know, and, you know, when you're in that, when you are not taking care of your mouth, your body pays for it. Definitely. And with the elder, and especially with people who take a lot of medications, who get dry mouth and stuff like that, dry mouth leads to bacteria. Bacteria leads to tooth loss, bone loss. Those things happen. If you are a person who has never seen a dentist a day in your life, you need to make arrangements. You need to get in there. If you have a 1-year-old who has a tooth, as soon as your child strikes a tooth, they need to go to the dentist.
Oh, wow.
Yes, we see babies as young as 8 months old. Okay, some kids get born with shark teeth. Okay, it happens because one thing that we don't recognize is in our embryonic stages of being developed, we get teeth before we get eyes. We get teeth before we get fingers. You develop a skeletal bone structure in your mandibular. You get your jawbone first before you even get an eyeball. So we need to be cognitive of that. And it's one of the reasons why a lot of us feel bad on the inside. It's because we're not taking care of our teeth properly. So that's
so
just
if you've
basic.
never seen a dentist, or you haven't seen a dentist in a long time, you know you got these teeth, and can it be corrected?
Yes, some things are reversible.
Okay.
Like periodontal disease, gingivitis, for instance, is totally reversible.
Okay.
A good mouthwash, good being attentive will reverse that. Some things are not, like bone loss. When your gums start receding, that's gone. Once you lose bone, you can't get it back. But there are things that we try to do in the dental office that put you back on a level where you're stable, but you have to continue that at home. So seeing your doctor twice a year, every 6 months, you know, maybe you need to see your doctor every, 4 months and stuff like that too. You know, you have a lot of crowns, you have a lot of fixed prosthodontics, you have partials, you have dentures. You probably need to be in the dentist a little bit more.
Okay. Yeah. Okay. That is some good info. We don't. Some people, we go to get our teeth cleaned every, twice a year, but I don't think that we really take the time to understand how important the health of the teeth are and how it interacts with the rest of our body.
Yes.
You're wondering why you got a headache. Well, it's probably because you got a tooth. It's possible that you got a tooth.
That could genuinely be it. The mouth is all connected to the ears. It's all connected to the jawbone, to the nose, to the eyes. That's all a part of your mouth. So when you think of your dentist, really consider this person as a doctor. We discover oral cancer. We discover throat cancer. We have even found respiratory issues just by checking your teeth. We can see that you're breathing wrong. We do sleep apnea in the dental office. We even give Botox, which is a great cure for headaches. All of this is connected. So your dentist is a doctor who has went to school and practiced internal medicine, so they can diagnose, they can write scripts, they can send you to another doctor if we feel like you had a lump on your neck. Maybe we need to do a biopsy. We need to check on that. And I tell people all the time, if you're going into major surgery, you need a dental clearance. You need a dental clearance. If you're getting your knee replaced, you need to go see the dentist first. Because endocarditis is real. And endocarditis is when bacteria from the mouth goes into your bloodstream. And it goes into your joints. And it's settled in. And it's hard when you're on those type of medications to bounce back from this illness because your mouth is genuinely bad. At Northwestern, we give you a dental clearance. We pull teeth before you go to surgery. We can knock your teeth out in surgery. Your tooth can actually come out in surgery. We do all of those things. So if you have someone in your family, someone that's going into surgery, you need to advise them strongly to go have their teeth checked before they hit that table.
Okay. That's good insight. Okay, Facebook viewers, we're talking about oral health. So we also have your BFF sitting next to you. So, and you're going to talk a little bit about mental health and really a focus on veterans and them coming out and what they're experiencing and just that whole aspect of veterans and mental health.
Yeah, so I guess for lack of a better term, a shameless plug or so, I actually will be speaking at that event.
That's right.
So, yeah, so I will be there for that as well. So I hope come one, come all. But yes, I will be speaking on veterans. So I looked at the JAMA psychiatric study study. It's about 2014. And it's really saying that 1 in 4 active duty members have some level of mental health issue. I come from a military family. So the military and veterans and active duty, I have cousins that are still going overseas, that are still being called to active duty and stuff like that. I have friends. So this is a subject that is very near and dear to my heart. And all of them, I have some who have been in service for 20 years and are just retired. Some, you know, have done only 4, some have done only 8. But all of them have, you know, one thing relatively in common, and that is that they don't regret their decision to be called to service or to even sign up for service. So they're okay with that. It's just those certain things that, you know, we're getting in here, we see what's going on, maybe not with themselves personally, but what they're seeing happen to their peers. I've also had friends who have dealt with mental health issues as well, dealing with PTSD, which is one of the primary mental health issues amongst veterans and active duty. So there is PTSD, depression, and post-traumatic brain injury or traumatic brain injury. And this can come in many different ways. It can be from combat. It can be, believe it or not, from sexual assault. Those things are actually happening, you know, within the military, and nobody's really talking about that. Domestic violence, these things are also taking place. So, you know, they are, yes, going over to fight, and they're dealing with military life, but when it comes to their housing and different things like that, it's really no different than what we are dealing with here. Where the issues come in, what I've heard most common is that when it comes to mental health and how that is treated, it is very leisure. It's very lax. It's like, you know, yes, we have, you know, the crisis hotline, we have the VA, we have these things, but there's no transition taking place. So you are discharged, and it's like, okay, we'll go for what you know. So nobody is saying, you know, hey, we went through all this training, we went through this basic training, we went through all these different things to get you mentally ready to be a soldier. But now, what does this look like for you when it's time for you now to integrate back into civilian society? So now, you know, when it comes to your interpersonal relationships, which is really the relationship that you have with yourself, your ability to be self-aware, how you see yourself around others, how you're treating others. And that can become a little difficult when you've been trained that what you say is law. Nobody's, you know, nobody knows more than you. Nobody's, you know, more right than what you are. You know, there's some narcissism that comes into play. There's some superiority and things that come into play. Instead of just really being aware of what's going on around you. So that's when those what we call intrapersonal relationships come into play. And so what that is how you're dealing with the people around you. You know, again, are you being able to sit back and hear just simply a balloon pop? You know, something's just as simple as that. You know, are you able to do that? Are you able to sit around a friend and fall asleep? You know, hypersomnia, which is when you are sleeping more than what's normal or what should be deemed normal, or insomnia, which is when you're not sleeping enough. These types of things come into play. So again, it can manifest, all these things can manifest in many different ways. Depression, I've talked about in radio shows before, where, you know, we have this idea that just simply being depressed is being sad. And that's not, that's a symptom of depression, yes, but that's not what depression is. So, you know, as we've said probably in a Facebook message before, check on your people. Check on your people. You know, when they're unmotivated for things that they should be motivated for, you know, when they're feeling hopeless or when they're feeling worthless, or when they're using substances a little bit too much. You know, that is also something that's been very prevalent in the interviews and stuff that I've done with family and friends who are veterans. There's a lot of substance use that's being used because they're trying to escape from reality. And so again, it's just really the transition. There's not a formal transition that is taking place. Like with any other issue, again, like the prison system or something like that, something where your mind is being changed, where your behaviors are being altered simply because of your environment. So we're not transitioning properly our people and making sure that they're okay until it's too late. So we have suicide as well. That's also very prevalent within veterans because they just can't bounce back.
Can't cope.
And exactly, they can't cope. And then so there's no referrals that are taking place. There's nothing that is happening, which again, on another side of that soapbox is giving us as licensed professional counselors, which is something I don't think that I mentioned. So yes, I'm a licensed professional counselor, but the state of Illinois National Certified Counselor. And so we're very limited as well into how we're able to treat veterans, the access that we have to them. They're very limited within an exclusivity when it comes to their services because the VA wants to take care of these things or they have a certain monopoly on who gets to help them. And so I think as people who serve this country, they should have the right to go where they choose.
And what about oral health as relates to veterans and what services are available to them?
Definitely. Tenisha piggybacked on some things that was very, very correct as far as how the military and veterans are, you know, how the military does their veterans when it comes to health care. And dentistry is just as limited as the ability to have this mental health help that you need. I'm learning that there's 1.4 million active duty people in the military right now. The military spends over $1 billion on dental care going into the military. So when you go in, you get the package, okay? Because again, oral health is essential to the body, so we have to make sure that every aspect of you going in to fight is all together, right? But when you get out, it's a totally different ball game. I'm finding out that you are disqualified to join the military. You can't even join the military if you have jaw and tissue damage.
Wow.
You can't join the military if you have TMJ dysfunction. You cannot join the military if you've had any kind of congenital injury to your head, neck, or face. You cannot join the military if you have severe malocclusion. That means you cannot chew, you cannot open and close your mouth. All of these things will literally get you disqualified. You can't even join the military if you have braces.
Wow.
You didn't know that.
No, I
you
didn't.
cannot have any ortho appliances joining the military, and you need a complete dental clearance to join the military. Now, once we're out and our veterans are out here and they are not getting the insurance, and you know, TRICARE has now changed who they are, so this doesn't apply to veterans now. You now have to find some type of resource to sign up to even get that care that you need. Is so limited. The VA does have a program, which we do understand. It's been around for years, it's respected, but it doesn't always apply to everyone. And not everyone can take advantage of that, especially if you're not if you haven't been active duty over 120 days. So it's like, now where do I go? Where do I go? So I know about the Fed VA program, the Fed Up, where they actually extend themselves. They have doctors who go out that do pro bono work, like Aspen Dental. Aspen Dental does something every year. Around the first week of June, Aspen Dental, 500 offices, they give free dental care to veterans.
Oh, nice.
Just veterans. Free. Free. So every beginning of June of every year, Aspen Dental, they open up 500 offices all around the world, and they give free dental benefits to all veterans that year. We have 103 clinics in Illinois who give free veteran dental services. So I would definitely have those on your blog and post those up to the Doty Report, where you can go and get these benefits, because now the VA is charging anywhere between $20 to $31 for one person, and your family is anywhere from $50 to $110 a month for dental care, but you only subject to one cleaning a year. That doesn't work for anybody. So these resources are very scarce, and we need to start opening up these channels to these veterans. Like Tenisha said, the resources are so limited for these type of people who have no direction. When you get out of the military, you're kind of trying to, it's like college. I graduated.
Right. Now
what do I do? You know, where do I go from here? And you have these expectations. Like my diploma gave me expectations. I'm like, I got this. Put me in. And I'm military. I served. Where do I go? Well, we don't have these, we don't have the funding, we don't have the resources, we don't have the doctors, because like Tenisha said, money, 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 you know, everything has this train moving where, you know, it pays to play, and if I need help, what do I do? And I can't always go to public assistance. I can't always go to Department of Human Services. I can't, and half of the time I don't qualify. I don't have a Medicare card, I don't have Medicaid, I don't even have the address, as Tenisha would say, or I'm not even in my right mind to know that my family needs to pay attention to this. You know, so my mouth as well as my mind.
Well, we are going to be sharing some of this information on August 1st. It's August 1st from 10 to 2 p.m. at the Kroc Center. It is Stand Up for Veterans Health and Resource Forum. We have various esteemed guest speakers, including Tenisha.
Yes.
Tons of resources, tons of information, lunch, light breakfast, some entertainment. We are just calling all organizations that serve veterans or family members that have veterans in their family to just come out. Save the date, August 1st, 10 to 2. The goal is to really be able to provide veterans, those that are really in need of some support, some guidance. We got like 1 minute left, so we're gonna give you 30 seconds and 30 seconds to give your final thought.
Oh my goodness!
What's your thought, girl?
Look, I had to have my 30 seconds just thinking of the thought. I can't express enough, very cut and dry, that mental health in any aspect, veterans, yes, but within our communities, it's so important. If you have access to a therapist, if you are able to just simply have enough courage to say, you know what, I am feeling this way and I need help, this is bigger than me, please reach out to the resources that you have, reach out to your friends, reach out to your doctors if you have them. Just simply going online to look and see what resources are available to you in your community. Please check them out.
Love that.
Definitely. Yes, my final thought is definitely remember your teeth are just as important as your heart. And if you are feeling sick, you're feeling ill, if there's some things that's going on that you just can't explain, I would definitely say see your dentist, talk to your dentist, understand that there's a connection, you know, HIV, hepatitis, leukemia, all of these things have some type of role in your teeth. Keep your teeth clean, brush them every day, encourage your children to change your toothbrush and keep smiling. Keep smiling.
I love that. Thank you, ladies.
Thank you.
Thank you for having us.
Thank you.
Tons of great information. You guys know to look for me on Facebook, Yolanda Gibbons. Tomorrow morning, I'm going to be giving them some kudos, tagging them up. Definitely so you'll be able to reach out to them yourselves and get even more information. This has been the Doty Report on Comprehensive Health. This is the last show until October. We thank you so much for watching us this past quarter every Tuesday at 7:30, and we just want to wish all of you a great, healthy rest of the week.
That's right.
Yes.
Yes.